Hello, my name is Nick Hartog, and I am here to do my presentation on newly diagnosed type 1 diabetes in children. So what is type 1 diabetes? Type 1 diabetes is a chronic condition where the pancreas is unable to produce insulin. It's what insulin is a hormone that allows sugar in the blood to enter cells to produce energy, and it's very vital for our survival, and there's no cure. So in a regular person, um, the pancreas will produce insulin. It will take the glucose that's in the blood, and it will allow that glucose to be put into the cells and be used as energy. The excess amount of glucose in your blood will be then transferred to the liver and then be stored as glucagon. Um, and then your liver will break down glucagon into glucose again, um, if you haven't eaten carbs in a while, to just keep your blood sugar at a normal rate, or at a steady rate throughout the day. But type 1 diabetes is not able to do this. So the body will actually attack the pancreas, and it will attack the insulin that is produced, thinking it's a foreign substance, thus, thus not being able to use insulin for blood sugar control. Um, and then uh, for high and low blood sugars in the blood, it actually can cause severe complications if it's not treated properly. So there's a couple risk factors for type 1. You have family history. So anybody, if you have a parent or sibling that has a type 1, your chances of getting type 1 as well is slightly increased. You have genetics, and you don't even have to have a sibling to have type 1 for you to get it. There's just a certain genes that indicates an increased risk of developing type 1. I thought this one was interesting. Geography is the further away you go from the equator, the more likely you have a chance to getting type 1, or I should say it's the likelihood to increase numbers of new cases in type 1 diabetes in the wintertime. And then you have age. Type 1 can actually appear at any age, either as a young child, adolescence, or a young adult. But that there's two noticeable peaks. You have the first peak usually occurs between 4 and 7 years old, and then the second is usually between 10 and 14 years old. So now we have some symptoms. Most of these symptoms usually come from high blood sugar. And the four main types that you will encounter are the 4 T's. So you have thirst, toilet, thinner, and tired. Thirst is usually an excessive amount of thirst. Excessive amount of thirst just due to the high blood sugar, and that's your kidneys are working overtime to trying to absorb the excess glucose that's in your blood. So when you're constantly drinking because you're constantly thirsty, or you're going to be constantly going to the restroom, you're going to be constantly going, you're urinating, and you usually tend to urine more often, and this can also possibly lead to sugar in your urine as it exits your body. You'll become thinner with weight loss from dehydration and loss of calories, or a restriction of calories from the diet that the child might be eating from. Even though the child will still have a normal appetite. And then you're going to also start to feel fatigue. This is usually caused by the fluctuations of the glucose in the blood. And then you have a couple other ones. You have like irritability and some other mood changes. And again, this is going to be because of the fluctuation between your blood sugar levels. It can really be tiresome just dealing with that. It could be frustrating for a child sometimes. And then blurred vision as well. So the fluid that moves into and out of the eye may increase due to high blood sugar, and this causes the lens of the eye to swell, and the shape changes of the eye, causing misaligning of the lenses. But so, and you also a long period of time with dealing with like high blood sugar, it can lead to damage to the eyes, the kidneys, the foot, nerves, blood vessels. Very low blood sugar levels can lead to seizures and comas in kids. So, what can we do as parents when we're taking care of our child? We must manage blood sugar as best as we can. We can use certain instruments for us to keep an eye on blood sugar. You have like a blood glucose monitor, which is worn either around the arm, the stomach, or the lower back. And it can update every 5 minutes or so. And that information can be sent straight to the parent's phone now these days. So you can really use the technology to really be on top of monitoring blood glucose. You're going to be using, this is the most common way that people deal with type 1 and type 2 diabetes, but it's an insulin injection with a flying needle. It's usually inserted within the stomach and the subcutaneous route. You have A1C test, and the A1C test is a test that usually it measures between 2 and 3 months of your average blood glucose levels. It's probably the most important test that most doctors look at when assessing a patient or assessing a child that has type 1 diabetes. Then you have an insulin pump as well, which is about the size of a cell phone. It's usually worn outside the body, and it can be worn around the waist or the arm. And then for blood glucose, we want to target between 70 and 150 millimoles before meals. We want to measure 2 to 3 hours after meals. We want to measure a child should be around 180. And then a child at bedtime throughout the night should be between 90 and 150. And then another way to make sure that we are watching out for our kids is just recording what the child eats. It gives us a good idea of how much the child is eating when it comes to carbs, proteins, and fats, because probably the trickiest part when taking care of a type 1 diabetic is, especially as a child, is that the child's body is always changing. They're always doing different activities. They're going to always want new foods, and they need a large amount of calories to grow. It's going to be very challenging for a parent to make sure that they're on top of their child's insulin and making sure that they get, and blood glucose, to making sure they're getting the proper amount of both, so further complications don't happen down the road. So one of the ways to approach a diet is to have some sort of meal planning regimen with your child. We're going to use nutrition labels. We're going to measure cups and spoons. or use digital food scales, restaurant nutrition information, smartphone apps to help us keep track of how many carbs are in certain foods. And then the goal is to, it's just going to be the same as all the other kids. We got to still make sure that the kid is getting the proper amount of nutrition for a good overall health, normal growth, and healthy weight. So there's 3 common approaches that we can take with the meal planning. You have the exchange meal plan, the constant carbohydrate meal plan, and the carbohydrate counting meal plan. The constant carbonate meal plan, or I'm sorry, this is the exchange meal plan. The exchange meal plan is divided into 6 groups. You have starch, fruit, milk, fat, vegetables, and meat. Each serving is going to have a similar amount of calories, protein, carbs, and fat. This will allow a lot of flexibility within the diet. Number of servings of each group recommended for each meal and snack is based on the total calories per day. So, and you can also use a diabetic or diabetes healthcare team to provide an exchange list of foods that you can use within this meal plan. And then the next one is this is your constant carbohydrate meal plan. This is based on eating a balanced diet, and it's focused more on matching the amount of insulin a person takes with the amount of carbs they eat. Each set of amount of carbs, each meal then takes insulin at set times and amounts each day. It lacks flexibility, unfortunately. It's probably the most strict. And the advantage of doing this one is that it's very simple to follow. Now you have carbohydrate count meal plan. This is probably going to be your most common meal plan parents do with their children. You're going to match insulin dosage with carb amount. So this one, this is reversed. You're going to match the insulin with the amount of carbs compared to the other one where you match the carbs with the insulin. You can help achieve better blood sugar levels. This allows flexibility, and you don't have any set times of when to eat and when to use your insulin. So now going more into the diet of a type 1 diabetic child. There's no such thing as diabetes diet. So kid could basically, I mean, if they wanted to, they could eat whatever they want. Obviously, we don't want this. We want to make sure we have the proper amount of nutrients for this child and the proper amount of carbs for this child. So there's no complications, but there is no such thing as a diabetes diet. It's important to center the diet around nutritious, low-fat, high-fiber foods, though. It's more ideal. We want to focus with fruits, vegetables, and whole grains. These whole grains are usually reinforced with some nutrients. Limit animal products and refined carbohydrates. You can be a little bit more lenient on the animal products, but the refined carbohydrates is something you really want to worry about the most. We kind of want to stay away from that, even as just a regular child eating or an adult. We're going to encourage lots of greens and orange veggies each day, and vitamin-rich brown rice or sweet potatoes is also a really good go-to. So we want to hit about 10 to 20% of our calories will come from protein, 25 to 35 calories come from fat, 50 to 60% of calories will come from carbs. Parents will need to learn how to count carbohydrates. It's very important for the parent to be familiar with the amount of carbohydrates in each food that their child eats, because this will allow the parent to administer the proper amount of insulin. And then also understanding labels. If a parent is not used to looking at the labels before they buy foods, now is a good time to start doing that, because you absolutely have to know what you are giving your child in each meal. So for protein, and focus mainly on meat, poultry, fish, cheese, eggs, and some plant-based proteins, which is like beans, soy, nuts, and seeds. But just be aware that a lot of plant-based proteins have carbs in them. And they're usually between like 3 and 15%, or 3 and 15 grams. So some of these plant-based proteins might be like peanut butter, which averages between 3 and 8 grams. And then you have like hummus, lentils, beans, and those usually will average about 15 grams of carbs along with the protein. So now we have fats. We need monosaturated fats for growing healthy and strong. This is like your omega-3s. So the foods to try to get your child to eat, if at all possible, would be stuff like avocados, almond milk, fish, grass-fed butter, olives, seeds, and cheese. We want to stay away from trans fats as much as possible, because this can cause your bad cholesterol, your LDL cholesterol, to be high, and it increases the risk of heart disease and stroke down the road. So we want to avoid foods such as donuts, fried food in processed oils, cakes, margarines, cookies. And then we want to limit saturated fats when we can. So this is more sugar foods that may be very common for a child when they want to grab something to either to drink or breakfast foods. A child may want like energy drinks. They maybe want some flavored milk, like chocolate milk, like eggnog, which is a little bit more seasonal. Fruit juices, regular soda, sports drinks, lemonades, sweet tea, etc. And then we can possibly, if we can, we could substitute those types of drinks with, instead, like stuff like Crystal Light, Mio, diet soda, or something like Powerade Zero. And then breakfast foods too can be very challenging, because there's a lot of processed breakfast foods out there. So you have breakfast pastries, donuts, flavored oatmeal, Pop-Tarts, toaster pastries. There's a lot of simple carbs when it comes to breakfast, so we would try to limit that stuff as much as we possibly can. And we would want to aim for less than 10 grams of sugar per cup and 3 or more grams of fiber per serving. We also would like to try to manage sodium intake as much as we can. Too much sodium can increase the risk of hypertension, heart disease, and stroke down the road. Good to keep an eye on early childhood, so you have a grasp on it later on in life. So the foods that are out there that have high salt are like stuff like canned vegetables, canned soup, chips, crackers, pretzels, breakfast cereals, bread, baked goods, lunch meats, processed proteins such as like hot dogs, frozen pizza, breakfast sandwiches, microwavable meals. All of that stuff has a very high amount of sodium, so we want to try to avoid that stuff as much as possible for our child. So the ways we can limit their sodium intake is eating less processed foods, eating less out at restaurants, eating fresh and frozen veggies over canned, look for low sodium or no added salt labels. Eating less out at restaurants is also very challenging, although I think it's probably one of the more manageable ones. Just as long as you ask your waitress if there are foods on the menu that have less salt, or you can ask for no salt and see if you can get the nutritional labels from the menu, or uh, the nutritional facts of their foods on the menus if it's possible. So now we have a couple other treatments outside of the diet that we can use to manage type 1 diabetes. And the biggest one here is going to be physical exercise as much as possible. So we recommend, or I should say according to Mayo Clinic, they would recommend at least 1 hour a day for children. Now, hopefully this is kind of easy to meet since children are already pretty hyper and pretty active when they are growing up. So we just want to encourage that as a parent, and recognize that they are doing fun stuff outside, either with their friends, and keep encouraging that behavior. We want to also, if their child is not very active, we want to try to find activities that your child may enjoy. This can maybe take some time to figure out, but I think it's definitely possible. Children, I feel like, have an open mind and they might want to try a bunch of new things. Another way to encourage physical activity is being a role model. If your child sees you being active and how much you enjoy it, more than likely they're going to try those things too. They're going to see that you're having fun and they want to be just like you. So they're going to try to have fun being active as well. And always remember though, whenever a kid goes outside, or if you ever go out to do an activity, to bring some sort of to-go kit with your diabetes care essentials. And then another thing to keep in mind is just to make sure that you adjust the meal plan or insulin to compensate for increased activity, because that can throw it off. And it may take some time to get the idea of the proper amount of insulin to inject into your child after an activity. But if they're doing at least 1 hour a day, within a couple of days, you should be able to figure out just how much insulin you should give to your child, and just adjust from there. So being a child just newly diagnosed with diabetes, it's going to be tough. It's going to be challenging. It's going to be kind of scary for a child. You're going to be pricking his fingers, going to be pricking his stomach. You know, he's not going to be very thrilled about that. So we want to try to find ways as parents to help our child cope with having type 1. You want to make sure that you're informing yourself as a parent to make good decisions that are best for your child. You want to find ways to help your child feel in control. You want to see if you can find support from others, such as family members or friends, or maybe even other parents who have their child with type 1 diabetes. Just make sure you treat it openly, keep an open mind, and understand where your child is coming from with some of the complaints that he or she has. And we also want to make sure that we are careful with caregiver burnout. So what is caregiver burnout? Well, it's defined as a physical, mental, and emotional exhaustion that comes with caring for a loved one dealing with any variety of health issues. You need to be able to take care of yourself first before you take care of a loved one. And if you can't take care of yourself, it's going to just make it that much more difficult to take care of your child with type 1, because taking care of a child with type 1 diabetes is basically a full-time job. It's 24/7 and it's 365 days a year. So you just want to make sure that you are allowing yourself a break every once in a while to prevent from burnout. So some signs to watch out for is constant fatigue, withdrawal from family and friends, change in eating patterns, excessive use of alcohol, feelings of depression. And then if you are feeling those, what you can do is possibly seek some counseling. You can attend a support group. You can stay involved in hobbies. You can rotate caregiver responsibilities with other family members or friends. And you can reach out to your child's healthcare provider for any additional support that you may need. And then you have a few useful websites a parent can go and take a look at. The first one is Cornerstone for Care. It's a good downloadable resource that includes meal plans for kids. And then it also contains some articles pertaining type 1 diabetes. You have the JDRF, which is specifically for type 1 diabetes. It supports for child of all ages of life. And it has online community support, virtual events, and local chapter search. There's a chapter in Indianapolis, for instance, probably one of the closest ones. And then they also have fundraising events. I think it's definitely a good site to take a look at. And then your last one here is Children with Diabetes. It reviews basics, care suggestions, and much more. Very basic stuff, but a lot of information. It has online forums. And you can sign up for camps as well. And you can search by state to find these camps. And then always, always, always remember that when you're taking care of your child, being a child comes first, and then treating diabetes comes second. And then here are my references. All right, and that's my presentation. Thank you very much.